Hi guys, how many of you have heard about a term like helter-skelter, or have seen this helter-skelter, or have read this novel Chaos Helter-Skelter? So where do you use this term in pathology? So this is very classically seen in HOCM. So hypertrophic obstructive cardiomyopathy. So name itself is hypertrophic. So the cardiac myocytes are hypertrophic, and of course what happens is they are arranged in a chaos. That is, normally the cardiac myocytes should be arranged in parallel, but here they are like perpendicularly or haphazardly arranged. So what happens, because they are haphazardly arranged, there is a space between this. So what happens in this space? Interstitial fibrosis. So what do you see in HOCM? Three things. There is hypertrophy of the heart fibers, there is helter-skelter arrangement, that is haphazard arrangement of the cardiac fibers, and there is interstitial fibrosis. So because of this there is a typical banana shaped heart, and so these patients, typically they give you an history of usually a young person who suddenly dies whenever he is trying to do some physical activity. So that is HOCM. So that is what should be clear. The second cardiomyopathy which you should remember is this ninja star. So where do you see these ninja star appearances? So ninja stars are very characteristically, whenever you see more than 5% of the ninja stars, this is a very characteristic of titin mutation, which is seen in dilated cardiomyopathy. So remember, this is ninja star appearance, which is nothing but the nucleus becomes like a ninja star. So that is what is ninja star, which is typically seen in dilated cardiomyopathy. Coming to the third, what is this? So when the right ventricle, so this can usually it occurs in right ventricle, but can occur in left ventricle also. So when the muscle gets replaced by fat, so what will happen? So normally, the cardiac muscle cells are closely attached. So what happens? So calcium can go quickly from one cardiac myocyte to other, but in between, if suppose fat comes, what is going to happen? The calcium is not going to go immediately. So what is going to happen? So this person is going to get arrhythmia. So that is why this disease is called as arrhythmogenic right ventricular cardiomyopathy, and you see fat in the wall of the right ventricle. So that's very classical of ARVC, which you should be very clear. So these are three important cardiomyopathies that are commonly given in the exam, and let's answer this question here. So in this question, what is wrongly attached, what is wrongly asked? So remember, whenever you talk about rhabdomyoma, it's one of the benign tumors of the heart, and they typically have spider cells. Spider cells means the cytoplasm retracts from the borders. This is because it has a lot of glycogen. So that is why it looks like spider. So these are called as spider cells, and they're rich in glycogen. So they are strongly pass positive. Okay. So that is rhabdomyoma and spider cells. Bye.